All right, this is the high volt skill check, scanning of the room.
Should probably close my closet.
Nope, closet's in it. We'll scan that too. All right. Sanitize my hands. Good morning, Kayla. My name's Chad. I'll be your student physical therapist assistant today. How are you?
Good, how are you?
I'm well, thank you. So I saw recently you had your right knee reconstructed, had a total reconstruction surgery. How's everything feeling? All right, thumbs up. Everything's feeling good. So what we're going to do today is we're going to use high volt treatment. Have you ever had that done before?
No.
All right, so basically what we're going to do is we're going to attach 2 electrodes to you. One's going to have, it's going to be called the active electrode. It's going to have negative polarity. We're going to put that near your area of edema on your right knee. And what that's going to do is that's going to repel things like negatively charged cells like plasma proteins, macrophages, inactive neutrophils, things like that, things that are causing that edema. We're going to place the other electrode called the dispersive electrode up here near your rectus femoris motor point. And basically what's going to happen is the edema is going to fluid shift up near your groin. And once it gets there, it's going to get reabsorbed by some lymph nodes up here. And then from there, it's going to go to your heart, and then it's going to get filtered through the kidneys and then excreted. So that's how we're going to get rid of that edema. Does that make sense?
Yeah.
So I am going to be having to place my hands on you. I'm going to prop your knee up, and then I'll be also placing some electrodes with my hands. Is that okay if I put my hands on you like that?
Yep.
Okay, perfect. And then also before we get started, a couple contraindications and precautions we're going to avoid. Contraindications, you don't have an implanted pacemaker, correct?
Yeah.
Good, I didn't see that on your chart. And we're not doing this over the carotid sinus, so we're good there. In terms of precautions, you don't have impaired mentation, as we've been speaking perfectly today, and you don't have a history of cardiac disease per your chart. Is that correct?
Yeah.
Okay, perfect. So we got through all that. I'm going to place your knee. We're going to prep it up a little bit because we need the knee to be above the level of your heart to help reduce that edema. Is that okay if we do that now?
Yep.
All right. So we got our pillow here. And I saw you have a strength grade of 3- too, so I want you to help me as much as you can. All right, and place that down. Good, so we're nice and elevated there. Now I'm going to inspect your skin and give it a wash with the washcloth, and we're also going to measure that edema too, okay?
Okay.
So inspecting, everything looks good. I'm going to actually measure before we wash. But inspecting our area of where we're going to place our pads, everything looks good. We got normal skin color and normal muscle tone there, so we're good there. Let's get a measure of that knee edema in centimeters. Come underneath. That's inches. All right, we're looking at 42 centimeters. So I'm going to document that. I'll write that down. Now I'm going to give that area a wash where we're going to place our pads with just some water, okay? Water in a washcloth. I'm going to have a pad up here and one down here. They need to be 6 to 8 inches away, so that's why I'm just getting this whole area.
Okay.
All right. So we measured, we cleaned. Now we can place our pads on, Kayla. Do you have any questions before we put them on and get started?
No.
No? Okay. So this is our smaller pad, our active pad. It's going to have negative polarity, so I'm going to set that up. And we're going to place this one near the area of your edema. So we're going to put it right near your knee here, right near your VMO motor point. Good, making sure we're not under any bones. And then this is our dispersive pad. It's a little bit bigger, and it's going to have positive polarity. So we're at a big positive there. And this one needs to go 6 to 8 inches away. This one's a little bigger than it normally would be. So we're going to place this near your rectus femoris motor point in a nice meaty area. Does that feel okay?
Yep.
And then let me grab the camera so they can see that.
I'm just going to place it down.
So that's where our electrodes are placed. We got the negative near the area of edema and the positive as it fell off near the rectus femoris motor point 6 to 8 inches away. Now, Kayla, in terms of parameters, I'm going to set that up on the machine here. So we're going to set a pulse duration of 50 microseconds. We're going to set a frequency of 100 pulses per second. And intensity, when I turn it on, you should feel a slight tingle. So you're just going to tell me when you feel that tingle, and we'll stop it right there.
Okay.
And we're going to do this treatment for 30 minutes. So let me get it all set up, punch in our numbers, and then I'm also going to give you a bell and a timer, multi-purpose. So the timer is going to be set for 30 minutes. The bell is if anything goes wrong, you're going to hit the bell, or if something doesn't feel right, I'll come right over. So I'm going to give you those. And then let me set this up here. We're going to turn it on, and you tell me when you feel a tingle, okay?
Okay.
And we're turning it on. You tell me when.
When?
All right. That's 20 milliamps.
Okay.
So we are set at 20 milliamps. That's our intensity. Treatment has started. I'll be back in 30 minutes. Like I said, if you have any questions, hit the bell, okay?
Okay.
30 minutes later, we come back. How's everything feeling, Kayla?
Good.
Good, all right. So I'm going to turn the machine off to 0, 0, 0, 0. Now we're going to take our pads off, and we'll inspect the skin. Everything looks good there, Kayla. Everything feel okay?
Yeah.
All right, so no adverse reactions on the skin, and then we're going to remeasure that edema. See if we get any change in fluid shift. Measuring over the same spot. Now it looks like we're at 41.5. So got a very slight change in edema there, so we did our job. Do you have any questions about today's treatment?
No.
Nope, everything felt okay.
Mm-hmm.
So what we'll do next time is something similar. If that edema keeps creeping back up, then we'll have to look at something different. Because if this is systemic or chronic edema, then we can't be doing this treatment. But since this is just based off your surgery, we can continue to do this type of edema reduction treatment.
Okay.
Any other questions?
No.
All right, thanks, Kayla. I will be seeing you next time.